Male pattern baldness, also called androgenetic alopecia, is the most common form of hair loss in men. It happens because hair follicles gradually shrink over time under the influence of hormones called androgens, especially dihydrotestosterone, also known as DHT. Genetics strongly influence how sensitive hair follicles are to DHT, which is why baldness often runs in families. Scientists have discovered that the process usually starts many years before visible thinning appears. Each hair follicle naturally cycles through growing, resting, and shedding phases. In male pattern baldness, the growing phase becomes shorter and shorter, while the resting phase becomes longer. This means hairs grow back thinner every cycle until some follicles stop producing visible hair completely. That is why the hairline often recedes slowly over many years instead of disappearing overnight. One important fact is that there is currently no scientifically proven permanent natural cure that fully reverses male pattern baldness for everyone. However, many healthy lifestyle habits may help support scalp health, reduce inflammation, improve blood circulation, and protect existing hair. Some medical treatments have stronger scientific evidence than natural approaches, but nutrition, sleep, stress management, and exercise can still play a meaningful supporting role. Understanding the difference between supporting healthy hair and curing baldness is extremely important. Protein is one of the most important building blocks for hair. Hair strands are made mostly from a protein called keratin, and without enough dietary protein, the body may reduce hair growth. Foods such as eggs, beans, lentils, fish, Greek yogurt, nuts, and seeds provide amino acids that help the body produce keratin. Researchers have also found that crash diets and severe calorie restriction can sometimes trigger increased hair shedding. Iron is another nutrient strongly linked to healthy hair growth. Iron helps red blood cells carry oxygen to tissues throughout the body, including the scalp and hair follicles. Low iron levels can sometimes contribute to diffuse hair shedding and weaker hair strands. Foods like spinach, lentils, pumpkin seeds, red meat in moderation, and chickpeas contain iron, especially when combined with vitamin C-rich foods such as oranges or bell peppers. Zinc plays an important role in tissue repair and cell growth inside hair follicles. Deficiencies in zinc have been associated with hair thinning in some people. Pumpkin seeds, oysters, nuts, beans, and whole grains naturally contain zinc. Selenium, magnesium, and biotin are also involved in normal hair function, although excessive supplementation can sometimes cause problems rather than improvements. Omega-3 fatty acids may help support scalp health because they are involved in controlling inflammation throughout the body. Fatty fish such as salmon, sardines, and mackerel contain omega-3 fats, while flax seeds and walnuts are plant-based sources. A healthy scalp environment may help hair follicles function more efficiently. Chronic inflammation, poor circulation, smoking, and excessive alcohol intake may negatively affect overall hair and skin health. Vitamin D has also attracted scientific attention in hair loss research. Hair follicles contain vitamin D receptors, and low vitamin D levels are common in many populations worldwide. Safe sunlight exposure, eggs, fatty fish, and fortified foods can help support vitamin D levels. Doctors sometimes recommend blood testing when hair loss is combined with fatigue, weakness, or other symptoms of nutrient deficiency. Sleep is one of the body's most underestimated repair systems. During deep sleep, the body produces growth hormones and carries out important cellular repair processes. Poor sleep can increase stress hormones such as cortisol, which may negatively affect hair growth cycles over time. Experts generally recommend consistent sleep schedules and enough nightly rest to support overall hormonal balance. Stress management is another important factor connected to hair health. Long-term stress can push more hairs into the shedding phase through a condition known as telogen effluvium. Although stress alone usually does not cause classic male pattern baldness, it may accelerate visible thinning in people who are genetically sensitive. Relaxation techniques such as meditation, controlled breathing, yoga, and spending time outdoors may help reduce stress-related strain on the body. Physical exercise supports circulation, heart health, metabolism, and hormone regulation. Regular aerobic activity increases blood flow throughout the body, including the scalp. Resistance training and moderate cardiovascular exercise may also improve insulin sensitivity and reduce chronic inflammation. Healthy circulation helps deliver oxygen and nutrients to actively growing tissues. Scalp massage has become increasingly popular in discussions about natural hair support. Small studies suggest that gentle daily scalp massage may improve scalp blood flow and possibly increase hair thickness over time in some individuals. The pressure should always remain gentle rather than aggressive, because excessive pulling can damage hair roots. Many people combine scalp massage with relaxation exercises to reduce tension around the forehead and scalp muscles. Some natural oils are commonly used for scalp care, although evidence varies widely. Rosemary oil has attracted scientific interest because a few studies suggest it may support hair growth similarly to some standard treatments in mild cases when used consistently over several months. Peppermint oil and pumpkin seed oil have also been investigated in early research. However, natural does not automatically mean harmless, because essential oils may still cause allergic reactions or skin irritation. Smoking has been associated with increased hair loss in several studies. Cigarette smoke exposes the body to oxidative stress and may damage blood vessels that nourish hair follicles. Heavy smoking can also increase inflammation throughout the body. Limiting smoking and excessive alcohol consumption supports not only hair health, but also heart, lung, and skin health. Hydration is another simple but important factor. The scalp and skin rely on proper hydration to maintain their protective barrier functions. Drinking enough water supports circulation and normal cellular activity throughout the body. Extremely dry or irritated scalp conditions can sometimes worsen discomfort and hair fragility. Many people are surprised to learn that tight hairstyles and aggressive grooming can contribute to hair problems. Constant pulling from tight ponytails, braids, or harsh brushing may damage follicles through traction. Excessive heat styling and strong chemical treatments may weaken hair shafts and increase breakage. Gentle hair care routines help preserve the strength of existing hair. Scientific studies consistently show that genetics remain the strongest factor in male pattern baldness. If close relatives experienced thinning hair, the likelihood increases significantly. Researchers have identified many genes connected to follicle sensitivity and hair growth regulation. This explains why some people maintain thick hair into old age, while others begin thinning in their 20s. Medical professionals often recommend combining healthy lifestyle habits with evidence-based medical advice, rather than relying on miracle claims. Early intervention generally produces better results, because follicles become harder to recover once they stop functioning for long periods. Dermatologists may use scalp examinations, blood tests, and family history to identify contributing factors. In some cases, hair loss may also relate to thyroid problems, autoimmune diseases, medications, or nutritional deficiencies. The most realistic and scientifically accurate message is that healthy living supports the body that supports the hair. Nutritious food, regular movement, good sleep, stress reduction, and careful scalp care may improve overall hair quality and scalp condition. These habits also benefit cardiovascular health, brain function, hormone balance, energy levels, and long-term wellness. Even when genetics cannot be completely changed, supporting the body naturally can still help many people maintain healthier hair for longer periods of time.